Hi everyone, it's one of your nurses from Unified OSCE. Yeah, there's been a new update from the NMC UK as regards the marking criteria, and the focus of this video is just to get us informed about the new changes. Yeah, just log on onto the NMC website and you will find the link, and the link will be added in the description as well. You can always get the link and read the changes. And it says there have been a number of changes following feedback from the test design and development partner. The feedback from candidates brought about these changes. So the major changes we'll be looking at is the fluid balance chart. There is a change for the timing. The timing has been increased from 12 to 14 minutes. And for the MSU, the timing has been increased from 8 to 12 minutes. For the ANTT procedure, you are no longer required to declare clean hand and dirty hand in your ANTT. And in as much as possible, they are trying to reduce, the number of waste created. So for procedures that you don't really have contact with blood, body fluids, or any form of aerosol, you might not likely need to use gloves and apron. So that's the focus on the part that says changes to ANTT procedure. So this covers skills that is not strictly aseptic skills. So they want to reduce the use of gloves and apron in those stations or skill station. So that's what that is all talking about. And the new marking criteria, you can always look at that, and that's give you the updates. And something very important is like, I'll read that out. It says all test and delivery centers will be using the updated materials from Monday 9th of September 2024. And this will give candidates and employers time to prepare and incorporate the updated preparation materials into their learning programs and preparation. So if your exam is before the Monday 9th of September, continue with the previous marking guideline. And if your exam is on or after Monday the 9th of September, you should prepare yourself using the new marking criteria. So, and I'll just briefly take us through some of the changes. So the updates from September 9, 2024. The intramuscular injection, it's when you go to the point number 6 under your marking criteria, it says dons a disposable plastic apron. So previously, this was included in the old marking criteria, but this has been removed in the new marking criteria. So you might not likely need gloves and apron in the intramuscular injection scale station, but even if you use it, you won't be penalized for it. And your assessor might categorically instruct you at the beginning saying you don't need gloves and apron for this skill station. So just follow what is written in the marking criteria. And for the cleaning of the injection site, the new marking criteria says just verbalize that the skin or the area is clean and there will be no need to clean. And if it is visibly, it is soiled in any way, you go ahead and clean using your chlorhexidine wipe, alcohol wipes. So now let's look at the IV flush with the VIP assessment. On that aspect, it's just making it more clearer what the candidate needs to be aware of. They need to be aware of the fact that the normal saline is a form of injection. So in that part, the little changes is just that administer your drug following your ANTT protocols for your IV flush. Ensure you give the correct dose, check the expiry dates, and you undo the medication correctly. So it's just like just re-emphasizing the points you need to note. Then for your flushing, flush using the pulsatile technique And if you have an extension attached to your cannula, candidates should unlock the clip before the procedure and relock after the procedure. So it's just reminding you of things that are on the marking criteria previously. Okay, so then the in-hospital resuscitation has been removed from the new marking criteria. So that's it. Just find the link, click on it, go yourself, take your time to read through, and wishing you all the best.